Gentleman in the front row.
Yes, Jon Danzig, what happened to the original principles of the NHS and what would Mr Bevan think of all this?
Let's remind ourselves what those three principles are: that it meet the needs of everyone, that it be free at the point of delivery, and that it be based on clinical need, not the ability to pay. The questioner asks what's happened to those principles. Sean Worth, are they still in place under these reforms that you helped formulate?
The reforms have to be put in place in order to preserve those principles. Now, if you want to preserve the NHS, it's got to change, not hugely, but in parts. And competition, I don't think is the answer, but in some areas it works. We want to keep it free and everything else, but you can't do that if you're going to sit around and try and hark back to the 1970s and have no competition, no different providers, and the trade unions and the Labour Party running everything.
We do need to reform the system, but it's service reform that we need, not structural reform or more competition. We need to fully integrate health and social care, which is something I propose. We need to start in the home with all of the support people need, preventing them going into hospital. But the big flaw in what Anne and Sean have said is that they are saying that more competition equals more efficiency. And I'm afraid there is no evidence from anywhere in the world that more competition in healthcare makes it more cost-effective.